decided to title it with, it addresses big public health problems, and it's because it really does. And I think people, we keep talking about biometric and people want numbers and numbers and numbers. And I run into this all the time as a community researcher, as a dietitian trying to get people to eat healthier, because people are so focused on, well, I need to see changes in cholesterol and yada, yada, yada. And where I come from as a dietitian perspective to say, well, we got to back it up a little bit and say, we got to get people to eat the foods that will improve the cholesterol and not eat foods that are causing, harmful health impacts. So in my world, that's the level where I work at. If I can get people to say, I'm eating more fruits and vegetables, I'm eating less of something, we'll say sugar sweetened beverages. It's like, that's a big public health win. And I think people forget that, and they just want to see, where's the biometric data? So if you are working with these programs and you're doing those things, remind people of that because Brooke, Tim is mentioning that statistic of like 6% of Kentuckians are eating, 5 fruits or vegetables. That's our big public health problem, along with we have an obesity problem. We have all these diabetes issues and heart problems and this and that, right? But just don't forget just that level. We got to get people to eat things, and people skip over that. So that's why CSAs is addressing that big public health problem, because these people that participate in it, it's like they're getting this big old box of vegetables. Well, most likely they're going to do something. They're probably going to eat some of it. Maybe not all of it, but they're going to eat some of it because that's what you do when you have this big box of food, especially when you invest money in it. And I can't think of anything better than an employer when you think about investing in your employees to help them eat better. And fruits and vegetables. I mean, I'm such a big fan of eating more fruits and vegetables. But I do see the importance of, I don't know that you necessarily want to cover it 100% because you're going to have a bunch of people like, yes, I'm interested, and then you're going to get these farmers like, oh, these people are interested, we're going to start growing, but people are going to fall off, and then they're going to find like, I get a big box of produce, like keep getting it every week, all the, throughout the summer, and that, like, that's a lot. So it is important, I think, to have people do some sort of investment, and I don't think it takes a lot to get people, they put some money into it. It doesn't necessarily have to be hundreds of dollars, but, if someone's putting in like $50, they're going to remember that, like, I paid $50 for this, So I could see, it's important that you still have to have a cost, associated with it, but truly, I just really, it's one of the best investments. We at the university, we have, and probably at your university, you have smoking cessation problems. Well, why are we waiting for people to smoke? Why are we waiting for people to get diseases? And no matter where you're at with the disease, you're either before you have a disease or you're in the middle of, managing a disease. Fruits and vegetables are going to help, So these are all my talking points. You should take that. To get them pumped and be like, yes, we should support this. So again, we got to take a step back of, well, how do we get people to eat it? And then also recognizing other public health things that a CSA is addressing is that it's enjoyed by household, family members, friends, and neighbors. So it's reaching into a community. It's giving something people to talk about. And I keep seeing more things. I know you're seeing it too. It's just like how people are lonely, People don't talk anymore. Well, if you're handing somebody a zucchini, what does it say? You live out in the country, something like, you don't have friends, you don't have zucchini given to you, something like that. And it's like, don't leave your car on. And, just like people, they want, they have plenty, they're going to give it away. Well, that's going to start a conversation. So, when you just think about mental health, it's just like, there's a role for CSAs in that, just because it is a conversation starter. And then, people, it's like, well, what do we talk about? It's just like, you talk about weather, you talk about what you do with food. Like, that's everybody eats, right? So that's something, it's like, well, what'd you do with your zucchini? It's like, I listen to my dad, of all people. He's not, you meet him, you'd be like, you eat vegetables? But he doesn't look like he's unhealthy, but it's just like, you wouldn't think he'd be a man that would prepare a zucchini boat. And he's just, I swear, you're at the American Legion, but it's a couple weeks ago. I make the best zucchini pasta, blah, blah, blah. He's like bragging at people. You want some zucchini? He's like, I got some, blah, blah, blah. So he just shares it with everybody. So it gives you something to talk about. So there's a lot of different, mental health issues, or mental health benefits. The other part with it's shared in household and family members. That one picture, I made sure to include that because it's like it's showing a family. A family is together. Because again, going back to that, you have a big box of produce. What are you going to do with it? Well, if you have people in your household that's going to eat it, you're probably going to eat it together. Maybe some of it. But family meals, you hear about the health benefits of it for everybody involved. And I know when I take my kids for wellness checks, it's, how often do you eat family meals together? Because there's benefit in you sitting down as a family and eating, because chances are you're probably going to talk to each other. And that's the whole idea of relationships and mental health. And then you got the physical benefits of you're actually eating some fruits and vegetables. The point of you are saving some money. You have opportunity to educate because you're preparing meals. You got kids that are probably curious. I don't know if any of you have kids. I'm an old lady mama and I got little kids that will not get out of the kitchen. It's like, well, if you're gonna be in the kitchen, then you're gonna have to do something to help me kind of maybe, I think, because it ends up on the floor and this and that. But you can get kids involved, and you think about these recipes, that you have to prepare, and it's a generational thing. You're teaching your kids to cook. You're also passing on, important things, your culture to your kids, and where kids are losing that ability to cook. I think CSAs are helping that because chances are you're not going to eat everything raw out of that box. There's going to be some kind of cooking involved. And with that, you're doing family recipes, you're creating new family recipes, you're creating traditions. It's being carried on. And, we saw this really cool movement, especially during COVID, of everybody's canning, everybody's gardening, everybody's preserving, and that became the cool thing to do. And that skill was being lost, but hopefully, it's being brought back, and more generations are going to be able to do that. And cook, as simple as that sounds, it's just like people really, they don't know how to cook these days. So those are just some of the public health things I see as a dietitian, that CSA really, it has a part in. The other piece that people sometimes will miss is that, obviously it increases the quantity, but also the variety of fruits and vegetables. And that's also a big push. If you're familiar with the dietary guidelines for Americans, you'll see you've got a whole section dedicated fruits and vegetables, and not just eat, your 5 a day, but just like eat, so many from the reds and so many from the yellows and yada, yada, yada. So variety is also part of CSAs. That's a big difference between your farmers market voucher programs and your CSAs, because you're given this box of produce. And if you've invested a little bit of money in there, you don't necessarily want to waste it. Just like, well, let me figure out what to do with it. So now you're eating these different vegetables. You might not even know the name of it. You're like, well, I'm going to figure out how to prepare it. So it's forcing you to introduce this variety into your diet. So public health wise, in my world of dietetics, that makes me awfully happy because people are eating different foods. Let's see. Going back to that, if you're being given a box of food and you don't know what to do with it, and I know that Vanessa is going to be here tomorrow, they do a great job of helping people figure out what do you do with this box, and it's tailored. Each week, it's seasonal. People are growing similar things, so you have to help people use their CSA. So that's something UK does a really nice job of. They have a Facebook group, and I think that's that sense of community that I don't know if people appreciate it and how important it is, because once it's gone, I think, like most things, that people will appreciate it more. But it's you're talking to people. It's like when you pick up your CSA, you're talking to people. You're meeting people, this Facebook group and such. It's just you're going back and forth on things. But you need to teach people how to use, all of this food, and whether it's recipes or it's preserving it, because the last thing you want them to do is throw it away. The other thing I wanted to put a plug in, was Plated Up Kentucky Proud recipes, because I'm not sure if Vanessa will mention it or not, but that is something special to Kentucky, and you all, you're associated with universities, and I know for sure you have dietetics programs. So think about how you can get those dietetic students, nutrition students involved, because they always need, research experience, whatever experiences. So they put that on that resume, especially your dietetic students who are competing for internships. So try and partner with your nutrition departments. How can you use these students? And why am I going off on this tangent? Is because of that Plated Up Kentucky Proud recipes. Where that came from is there's a USDA specialty crop block, and we could apply for it. So a faculty member in our department just said, we're going to do a recipe development program. She had it for like 10 years. She kept getting it, and it would provide like $50,000 of funding. So what she did, she paired it with one of our cooking classes. It was DHM 302, our introductory to cooking class. So they ended the semester, they called it Iron Chef, that like the shows, cook off. But they had to create recipes that use specifically Kentucky specialty crops, because that was the grant. So then the different groups, they did their recipes. We had a taste panel come in eventually, just like people would judge it, and then we picked the best ones just as inside the department. Then we moved on to test it with extension agents and other people. And if they need to, we tweak the recipes further. But as long as the recipes were changed from whatever they were, if it was, was not from, somebody built it on their own, then we could claim it as ours because it had been adjusted. So then it became this program. We had like really nice, you can see the cards there, really nice recipe cards that are printed, and they're given to extension agents all over Kentucky. And so then it became available, and it's giving people ideas of how to use these different fruits and vegetables. It was easy to do because we had the dietetic students, the human nutrition students as the labor portion of it. So be creative, and maybe it's not even developing the recipes. Maybe it's who can come to these different farms and help pick, You're at universities and you have students, especially now because it's cool and hip to grow things and pick them, and also you have people that have never been out in the field to pick things. So like you all just say, yeah, of course, this is nothing new to me. As I talk to your students, you'll find like, yeah, they've never set foot in a field and walked through, picked weeds or anything, So figure out how to get students involved. Like they love to be outside, like for sure. I had them picking blackberries all the time. Like, this is the best, blah, blah. They're chatting with each other, have a good time. So just figure out how to utilize those different departments. Okay, so then measuring fruit and vegetable consumption. Whew, that's a bugger. And when you want to do a really good, thorough job, that's your 24-hour recall. And people are not jazzed about doing it at all. Even if you give them a link to do it on their own time at home, it takes time, and people get annoyed. If you are the one sitting down doing a 24-hour recall, it's like people, it takes time. So, but just know that if you have a control group, that data is just as hard to collect from them too as it is from your intervention participants that are getting these fruits and vegetables. So just keep that in mind. That's all that I always go back to. It's just like, it's hard with everybody. So everybody in your study, it's hard. So you just really need to think about your population, who you're collecting it from, and what's gonna work best. Because a 24-hour recall, maybe that's expensive manpower-wise, or if it's online, maybe your population, if it's given to folks that are in an area that, just say, well, this online connection, it's not gonna work. So you need to figure out what works best for your study. And for my studies, it's been just doing some sort of a recall, a food frequency questionnaire. It has not been a 24-hour recall. And it's varied in length. It's what, I talk with my community partners, I'm like, all right, this is a survey I'm giving them. When you consider these other questions I'm asking them, plus this, what do you think the chances are that they're gonna fill this out? So I work with my community partners to try and come up with what's the best way to try and capture this information? How long can we make this? And how simple does it have to be? Because I know I had numbers before, and I had a community partner say, not with my population. It needs to be basically like a 3-choice, like some, a lot, none kind of thing. It's like, okay. So just really rely on them. So these are just showing just different pictures of it, just different variations. It can come in all kinds of forms. I included this link because this is the National Cancer Institute's Dietary Assessment Research Resources, and it's not just showing you surveys for fruit and vegetable consumption, though it will tell you what it's focusing on. A lot of them, there are some that just focus on fruits and vegetables, usually a component, but it just is basically like a warehouse of different surveys of dietary assessment. So it's a nice little resource to have to peruse when you're thinking about considering different studies. What else did I have to? Oh, the finger. So you have this person look like they're sticking their finger in a pencil sharpener. Has anyone? Yeah, but they're not. That's a good thing. Anyone ever hear of a carotenoid scanner? Anything along those lines?
Veggie meter.
Veggie meter. Yeah, I think no. So those are getting more popular. We have them here. Martha has one. I have one. And this is one of your more objective measurements of fruit and vegetable consumption in the sense of it's good for capturing if you do an intervention, like you do a pre and a post, like did people consume fruits and vegetables because it's assessing their carotenoids. And it's skin carotenoids because of how beta carotene is stored in the skin, and it's considered it can, what is the word I'm trying to think of? Basically, it's as good of a measurement as when you draw blood and you are measuring serum carotenoids. It will not tell you that somebody is consuming, on average, 5 fruits and vegetables a day. It's not telling you that. It's you have your pre-level, you have your post-level, you see an increase, no change, and decrease. That's about what it's good for telling you. And I don't mean to say like that's about it. That's huge, because when you get that dietary data back, it's a hot mess. People and how they fill it out, you know how people are with surveys. But this is nice because people get excited about their numbers. And we even found, we just did it for the fun of it, just to do a midpoint measure because people just loved it so much to know their numbers. And they were getting very competitive about their numbers with each other. So it's just a good motivator, It just to get them excited about it and, maybe eat more fruits and vegetables because that's what's going to increase it is because you think usually like carrots and such containing beta carotene, but it's actually a pretty ubiquitous, it's a phytonutrient and it's found in a lot of different colors of fruits and vegetables. So that's why we focus on carotenoids. They're found in a lot of fruits and vegetables. But anyway, so that's the veggie meter. It is expensive, but it's becoming more popular, and it's a nice field tool because it is so small. You just have to make sure it doesn't get dropped or kicked around or anything. You got any other advice on scanning?
No, she was Brooks assessment. I think, as far as I know, there's still only one manufacturer. I don't know that anybody else has picked it up, so there's just one price tag right now. It's still one price.
Yeah, the price tag is about $15,000.
$15,000.
Yeah.
It's only one company making it, so as soon as somebody else makes it, it'll be.
Yeah, I'm sure it will go down.
We were like, that'd be fun to take to a farmer's market up there, but
It's
not
great.
at the gym.
So we've done that, taken it to a farmer's market, just because it gets people over there, because they're like, oh, go look at this, what's your number, is it higher, and then that's your way of capturing people, and you can give them information and this and that, and because people think it's fun, and it doesn't hurt, it takes a couple seconds, and
You used it with kids, right?
Yeah, and you can use it, doesn't matter your skin pigmentation, doesn't matter if it's youth, older adults, like across the lifespan, it can be used. It's fun, people get excited about it. So, yeah. Let's see, what other high point I want to mention? I talked about other measurements and just saying that mental health is another one, and recognizing and almost put on like an anthropology kind of lens, because I think people overlook that with these kind of programs because they're so focused on biometrics. But these days, because we are so concerned in hearing more about mental health, is think about different measurements of mental health and just social, the importance of those social gatherings. And then these are I just threw up the names of some of the programs that I have been involved in, just so it would remind me of different things I wanted to tell you about it and things to think about when you're doing CSAs. This one, what was unique about the Tanglewood Trail Walking Program is because it was a farmer's market vouching program, but it was voucher program, but it was tied with walking. So people wanted your voucher, you had to walk. So that got physical activity introduced, and that created a big social scene in Whitesburg, Kentucky. Well, that was one of the part of it. There was somebody there that, had brought like a concert series there. That was also huge. For Thursday nights, Saturdays, they had the walking program. But it gave families something to do. They'd all walk together, they shop together. So it was really cool. The Cane Kitchen Meal Program that was also out of Whitesburg, Kentucky. But a comment, I don't know, Tim, how often you get this, but a big criticism of these voucher programs, prescription programs, is that, well, that's nice, it's only 3 months out of the year. And then it's like the produce goes away. But in my opinion is, well, 3 months is better than nothing. And you might create some healthy habits in 3 months. And I don't know if fruits and vegetables is something that is currently part of your diet, but if it's something that you tend to do when you're not eating them, you start to miss them. And that's what we want to happen with that CSA and those farmers market voucher programs, is that you get people used to eating fruits and vegetables, but they're gonna miss it, But anyway, so along that lines, that criticism is just like, well, now the program's over. People, everything decreases their intake, yada, yada, yada. So our response was, all right, we're gonna partner with this community kitchen, and we're still going to use, produce from farmers, and do some fall vegetables, whatever's on sale at the grocery store that people have access to. And we created a healthy meal program. So then people were coming together to eat meals together. And it was successful in the sense that people were very interested. It was a 3-month program, and it was during those cold months, the winter months. School had started, and it was still a popular program. It was very hard to see the change in the biometrics, but we still saw that people wanted to come together, and people were eating these foods, and they were trying new foods and new recipes. So that was a big plus. And then I wanted to talk about this other community program that I did, the Fruit and Vegetable Box to Produce Good Health. And that program I'm really proud of because it was, I like to call it CSA-esque, in the sense of we worked in Clay County, Kentucky. And usually when you hear Clay County, people will think of the city of Manchester, and that's the county seat, and they have grocery stores populated and this and that. That's not where the study was. It was 45 minutes away in Beverly, Kentucky, where Redbird Mission was located. I don't think I've ever worked with a harder, more community resource strapped population than this, with Redbird Mission. The community partner was phenomenal. In Redbird Mission, they worked really hard. But every time I said, well, how about we do this? They're like, no, we don't have that. I'm like, how about this? No, nobody has cars. Nobody has phones. Nobody has blah, blah. Nobody has vehicles. It's just like, no, that's 45 minutes away. People don't have gas money. I was like, okay. So what we came up with was that they were working with a very low income population they were participating in an emergency food box program. So they were getting basically like things if you went to a food pantry, those type of foods. So I said, do you think people, and truly you don't even need to do fresh fruits and vegetables, because I know we keep talking about fresh fruits and vegetables, but if you're just trying to get people to eat fruits and vegetables, nutrition perspective, you can do it healthy, frozen and canned, because it's better to have it than not. Anyway, so I asked them, I say, you think they want some fresh fruits and vegetables? Yeah, probably, because there's this stigma with people that don't have money that they don't like fruits and vegetables. I'm like, I don't know that that would be true. However, I could see that becoming very true if people are growing up without it, and people aren't cooking, and people, they're just, it's not part of their meal, because when you start to eat something new, and it's a lot harder to start eating something new as an adult than if you're used to it, growing up with it, as a child. But, so anyways, I was just like, well, I don't believe that people of low income don't like fruits and vegetables. So let's see if they're gonna eat it. So we came up with a system. We paired it with that emergency food box program, because what these people would come out for and could do was at the end of the month, they'd come and get a food box. So we made sure that we had that fresh fruits and vegetables along with the box they're already picking up. So they could pick it up, their neighbor could pick it up, just however they could get it picked up. But typically the family themselves, some member of their household picked it up. And it worked beautifully. They only had to take one trip. And then we had them fill out a survey. They come back, because oftentimes it was the same people doing it. So they come back, and this was the population. I'd show my community partner survey. She's like, no, you can't ask the survey. It's way too long. Cut it back, cut your words back, blah, 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 blah. So lots of changes. But what we came down to, and I thought was really interesting and really cool to find out, was just like, what are you doing with your produce? And all I did, I said, this was what was in your box. And I made the list, and I gave them the options of, it's like, we used it fresh, we preserved it, we shared it, or we threw it out. And then I, had a question in there of just like, if you threw anything out, why did you throw it out? And hardly anybody threw anything out. It was either used, they ate it, or they preserved it, or they shared it. Like it was always, most consistently, that's how it was being used. Hardly ever thrown out. It was thrown out because sometimes there was something it was rotten. Apples were bad one time. There was like, the apples were bad, like they're not eating rotten food. Makes sense to me. So, but they were using it. It was a really successful program. People loved it. But it was unsustainable because I didn't have grant money to, continue carrying it out and such. But it was CSA-esque in the sense of they were not shopping for it. They were just giving a box of produce. And these were people that a lot of them were stay-at-home moms, and they had time to prepare recipes. So it was really interesting. We had just really great information out of that study. So I just encourage you to be creative in how you think about it. And I would have loved to do, and if you have time, do qualitative interviews and really, talk to people about what they're doing, with their produce and such, just to learn more about it. Because you get so much information out of a survey, but those qualitative, that's how we were learning about the social aspect of the programs and how important it was. So, so I just encourage you to start, partner, look at your dietetics department, think about partnering with them. Partner with anthropology people. I think because my program manager was an anthropologist is how I came up, I didn't come up with these ideas. We had these great ideas because, she had that anthropology lens on. So just be thinking about that and other ways to show value. And I say this just because biometrics can be tricky, it can be expensive. And just taking people back to remember, just like, it's not just biometrics, which obviously is wonderful if we can change it. I mean, that's ideal. But before we get there, we are seeing other positive changes. So, and to highlight those. Okay, I think that was it. Any questions?